Hello dear students. Today I will examine third lecture of radiotherapy. The subject of our today's lecture is methods and principles of radiotherapy. Okay, first of all I will say plan of our today's lecture. First of all, I will explain about aims of radiotherapy, about types of radiotherapy, and different methods of radiotherapy, such as external beam radiotherapy and internal beam radiotherapy. As you know, radiotherapy is a clinical modality dealing with the use of ionizing radiations to treat malignant tumors and sometimes benign disease. Since its inception, the goal of radiotherapy has been to cure cancer locally without excessive side effects. And the most important factors affecting the results of radiotherapy are the tumor type, its location and regional extent, the anatomic area of involvement, and the geometric accuracy with which a calculated radiation dose is delivered. Although high dose of radiation can produce better tumor control, the dosage which can be given is limited by the possibility of normal tissue damage. Approximately from 60 to 65% of all cancer patients require radiotherapy as the sole treatment modality and in combination with surgery and chemotherapy. Radiation therapy is an important tool for treating cancer and is often used in conjunction with other therapies such as chemotherapy and surgery. Radiotherapy can be used during different stages of cancer treatment and for different outcomes. Radiation therapy can be used to alleviate signs in advanced late-stage cancer as the primary treatment for cancer in conjunction with other cancer treatments, to shrink a tumor before surgery, and to kill any remaining cancer cells after the surgery. Okay. Radiotherapy is provided with three main aims: radical radiotherapy, palliative radiation therapy, and symptomatic radiation therapy. Some cancers are very sensitive to radiation. Radiation may be used by itself in these cases to make the cancer shrink or completely go away. In some cases, chemotherapy or other anti-cancer drugs may be given first. For other cancers, radiation may be used before surgery to shrink the tumor, or after surgery to help keep the cancer from coming back. For certain cancers that can be cured either by radiotherapy or by surgery, radiation may be preferred treatment. This is because radiation can cause less damage and the part of the body involved may be more likely to work the way it should after treatment. For some types of cancer, radiation and chemotherapy or other types of anti-cancer drugs might be used together. Certain drugs help radiation work better by making cancer cells more sensitive to radiation. Research has shown that when anti-cancer drugs and radiation are given together for certain types of cancer, they can help each other work even better than if they were given alone. Okay. Radical radiotherapy aimed at the complete destruction of tumor elements in the body and complete cure of patient. Of course, it is possible at early stage of malignant tumor, as you can see here. That is with help radical radiotherapy we can completely treat of malignant tumor. Next aim of radiotherapy is palliative radiotherapy. Palliative radiation therapy used in advanced inoperable cases to delay tumor growth, reducing pain, and improving the quality of patient's life. Incurable cancer causes many problems from local effects and the effects of spread to distant organs. Radiotherapy is the most effective treatment for people with incurable cancer. And in these cases, we use from palliative radiotherapy. In this picture, you can see principle of palliative radiotherapy. As you can see here, after providing of radiotherapy, you can see that the size of tumor, decreasing of size of malignant tumor. And finally, type aim of radiotherapy is symptomatic radiation therapy. Short course of radiotherapy is an excellent treatment for the palliation of bone pain, brain metastasis, and compression of vital structures such as the spinal cord, for example. That's symptomatic radiotherapy aimed at removing clinical signs such as bleeding, compression, and fractures. In this picture, you can see principle of symptomatic radiotherapy. There is no change in tumor size, but with help of symptomatic radiotherapy, we can decrease different signs of malignant tumor, such as pain, compression, and bleeding. In practice, radiotherapy is used in different forms, and it's depend on tumor size, it's depend on tumor sensitivity, and other factors. And we have three main application forms of radiotherapy: pre-operative radiotherapy, suboperative radiotherapy, and post-operative radiotherapy. Pre-operative radiotherapy is provided before the operation to kill tumor cells, to prevent metastasis, and reduce tumor volume. Suboperative or interoperative radiotherapy performed during surgery for tumor bed irradiation and prevent metastasis. That's interoperative radiation therapy delivers radiation to the cancer during surgery. The radiation may be given externally or internally, and it's often used along with the course of external radiation given before or after the operation. Interoperative radiotherapy is useful for abdominal or pelvic cancers that can be completely removed, and for cancers that tend to grow back after treatment. As much tumor is removed as possible, then one large dose of radiation is directed right at the tumor site. Normal tissues can be moved out of the way and protected, so intraoperative radiotherapy reduces the amount of tissue that's exposed to radiation. This allows a higher dose of radiation to reach the cancer. Intraoperative radiotherapy is delivered in a special operating room lined with radiation shielding walls. That's our main aim in suboperative radiotherapy, is tumor bed irradiation and prevent metastasis. And finally, post-operative radiotherapy performed in order to increase the efficiency of operations to destroy residual tumor elements. And post-operative radiotherapy is provided within 3 or 4 weeks after the surgery. That's depending on application form. We have three main forms of radiotherapy: pre-operative radiotherapy, suboperative radiotherapy or interoperative radiotherapy, and post-operative radiotherapy. Okay, that is in practice. We use radiotherapy alone and with other methods, with other treatment modalities. If we use radiotherapy with chemotherapy and surgery, we name it complex treatment. If we use two types of radiotherapy, such as distant radiotherapy and contact method, and we name it combined method of radiotherapy. Okay, we have two main types of radiotherapy: external beam radiotherapy, or sometimes we name it teletherapy or distant method of radiotherapy, and internal beam radiotherapy or contact method of radiotherapy or brachytherapy. That's depending on placing of source of radiation. We have two main types of radiotherapy: external beam radiotherapy and internal beam radiotherapy. Okay, external beam radiation is the most widely used type of radiotherapy. The radiation comes from a machine outside the body and is focused on the cancer. It's much like getting an X-ray, but for longer. This type of radiation is most often given by machines called linear accelerators. That's teletherapy or external beam radiotherapy. Is radiotherapy form of in which source of radioactive material are inserted outside from the body. For example, in this picture you can see a head of devices, and in this area, in this head of devices, is placed radioactive source, usually radioactive cobalt-60 unit. Okay. In this picture you can see also principle of external beam radiotherapy. The radiation is aimed at the tumor, but it also affects the normal tissue it passes through on its way into and out of the body, of course. External beam radiation can be used to treat large areas of the body. It also can treat more than one area, such as the main tumor and nearby lymph nodes. External radiation is usually given daily over several weeks. It is given in an outpatient clinic or treatment center, and so patients don't have to stay in the hospital. Thus, in external beam radiotherapy, source of radiation is placed from outside of patient body. Okay, we have different types of external beam radiotherapy or teletherapy. As you can see here, in this picture you can see different modes of external beam radiotherapy or teletherapy. For example, three-dimensional radiotherapy, intensity modulated radiotherapy, tomotherapy, different types of stereotactic radiotherapy, and other. In this picture you can see principle of external beam radiotherapy. Okay, but what is source in external beam radiotherapy methods? That's from which rays we use in this type of radiotherapy. About 16% of cancer patients receiving X-ray therapy, one type of external beam radiotherapy. It can also be used to treat many non-malignant diseases that don't threaten the life of the patient but cause suffering and lead to disability. That's one type of source of radiation, type of radiation in which we use external beam radiotherapy is X-ray therapy. Okay, X-ray therapy. X-ray therapy, one of the methods of distant or external beam radiotherapy. Depending on the distance of the source of radiation to the skin surface, is divided into radiotherapy short distance and long distance radiotherapy. That's depending on distance between the skin surface and source of radiation. X-ray therapy has two forms: short distance radiotherapy and long distance radiotherapy. The source of radiation in the X-ray therapeutic apparatus is an X-ray tube that generates photons with high energy. You already know production of X-ray. For low energy photons, used screening filters. For radiotherapy, applied uniformly high energy beam or photons. Tube serves to create field of radiation and to capture the desired distance from the source of radiation to the body. The method of X-ray therapy used to treat malignant disease of the skin, subcutaneous fat, mucous membranes, metastatic tumors, and lymph nodes. X-ray therapy, the only method that's used in the treatment of non-tumors disease. Thus, with help X-ray, we can treat malignant tumors, and you can see name of them here: skin tumors, subcutaneous fat tumors, metastatic tumors in lymph nodes, and we can use them for treatment of non-malignant disease. Okay. In this picture, you can see principle of short distance radiotherapy. It is skin cancer radiotherapy. Okay. When short distance radiotherapy is using distance from the source of radiation to the skin range from 1.5 to 25 centimeter. This method is used when placing the pathological focus to a depth of 0.5 to 0.7 centimeter from the skin surface. A type of short distance radiotherapy which is ultra radiotherapy. These rays are used for treatment of inflammation, dermatitis, and conjunctivitis. That's in short distance radiotherapy. Distance between source of radiation and patient is equal from 1.5 to 25 centimeter, and this method we use for treatment of pathologies to a depth from 0.5 to 0.7 centimeter from the skin surface. Okay. Medical linear accelerator customize high energy X-rays or electrons to conform to a tumor's shape and destroy cancerous cells while sparing surrounding normal tissue. I will repeat it. That our main aim in radiotherapy is maximal exposure of ionizing rays to tumor and maximal protection of surrounding normal tissue. With help linear accelerators, we can protect surrounding normal tissue. Linear accelerators devices that are widely distributed around the world and used to deliver high energy X-rays. It's one type of X-ray therapy also. Okay, a linear accelerator can be used to treat cancer in virtually any area of the body. It can also be used to execute a variety of radiation delivery techniques, including conventional external beam radiotherapy, intensity modulated radiotherapy, image guided radiotherapy, and stereotactic body radiotherapy. Okay, stereotactic radiosurgery use many precisely focused radiation beams to treat tumors and other problems in the brain, neck, lungs, liver, spine, and other parts of the body. It's not surgery in the traditional sense because there is no incision. Instead, stereotactic radiosurgery uses three-dimensional imaging to target high doses to radiation to the affected area with minimal impact on the surrounding normal tissue. Like other forms of radiation, stereotactic radiosurgery works by damaging the DNA of the target cells. The affected cells then lose the ability to reproduce, which causes tumor to shrink. Stereotactic radiosurgery of the brain and spine is typically completed in a single session. Body radiosurgery is used to treat lung, liver, adrenal, and other soft tissue tumors, and treatment typically involves multiple sessions. Okay. In this picture, you can see stereotactic radiosurgery, also called stereotaxy. It's a non-invasive form of surgery. And remember that all types of stereotactic radiosurgery and radiotherapy work in a similar manner. That these methods are non-invasive form of surgery, and this equipment focuses many small beams of radiation on a tumor or other target. Each beam has very little effect on the tissue it passes through, but a target dose of radiation is delivered to the site where all the beams interact. The high dose of radiation delivered to the affected area causes tumors to shrink and blood vessels to close off over time following treatment, robbing the tumor of its blood supply. The precision of stereotactic radiosurgery means there is minimal damage to the healthy surrounding tissue. In most cases, radiosurgery has a lower risk of side effects compared with other types of traditional surgery or traditional radiotherapy. And applications of stereotactic radiosurgery, in this picture you can see it, brain tumor, for example. Stereotactic radiosurgery, for example, such as gamma knife, is often used to treat benign and malignant brain tumors, including meningioma, different types of hemangioglioblastoma, and other. Stereotactic radiosurgery may also be used to treat cancers that have spread to the brain from other parts of the body, for example, brain metastasis. This application field of stereotactic radiosurgery is one of application field is brain tumors. Okay, artery venous malformations are abnormal tangles of arteries and veins in our brain. For treatment of them, is used stereotactic radiosurgery also. Stereotactic radiosurgery destroys the arteriovenous malformation and causes the affected blood vessels to close off over time. Also, this method is used for treatment of trigeminal neuralgia. Trigeminal neuralgia is a chronic pain disorder of one or both of the trigeminal nerves. Stereotactic radiosurgery treatment for trigeminal neuralgia targets the nerve root to disrupt these pain signs. Okay. These methods also can be used for treatment of Parkinson's disease, for tremors, and other disease also. Okay. One type of current technology in radiotherapy is gamma knife. Gamma knife radiosurgery is a type of radiation therapy used to treat tumors, vascular malformations, and other abnormalities in the brain. Gamma knife radiosurgery, like other forms of stereotactic radiosurgery, is not surgery in the traditional sense because there is no incision. Instead, gamma knife radiosurgery uses specialized equipment to focus about 200 tiny beams of radiation on a tumor or other target with submillimeter accuracy. Although each beam has very little effect on the brain tissue it passes through, a strong dose of radiation is delivered to the place where all the beams meet. The precision of brain stereotactic radiosurgery results in minimal radiation delivery to healthy tissues surrounding the target. Okay. During this method, injected contrast material injected with contrasting fluid and drugs. Patient first gets to computer tomography or magnetic resonance tomography scan of the target area. You know that with help this diagnostic imaging we can correctly estimate localization of tumor. After that, a computer takes the images created and combines them to form a three-dimensional map of the target area. The head frame is then placed on the patient as the operator sees fit, and the patient then lies on a special bed that moves backward into the machine. In this picture, you can see these processes. Advantages are able to reach tumors that are unreachable by conventional surgery. No physical cuts involved, this method is non-invasive method. Extremely accurate method. Takes less time to complete than comparable therapy treatments. More effective than comparable treatments. And less side effects than other treatment modalities. Disadvantages of these methods are side effects such as skin problems in target area, fatigue, hair loss in target area, headaches, brain swelling, and other. Can't destroy the tumor. With help this method we can just stop the growth of them. Expensive method, and results of therapy take time, as little as 1 month to as long as 2 years. Okay. Next type of stereotactic radiosurgery is cyberknife. The CyberKnife system is a non-invasive treatment for cancer and non-cancer tumors and other conditions where radiotherapy is indicated. It's used to treat conditions throughout the body, including the prostate, lung, brain, spine, head and neck, liver, pancreas and kidney, and can be an alternative to surgery or for patients who have inoperable or surgically complex tumors. CyberKnife treatments are typically performed in from 1 to 5 sessions. The CyberKnife system has more than 2 decades of clinical proof and has helped thousands of cancer patients. Radiosurgical procedures used in the following cases: for the treatment of many brain tumors, including benign and malignant tumors, primary and metastatic lesions, single and multiple tumors, residual tumor foci after surgery, intracranial lesions and tumors of the skull base and orbit, to treat arteriovenous malformations, and for the treatment of other neurological conditions and disease. All these conditions are important application fields for providing of radiosurgical procedures. Contact radiotherapy has 4 main types, such as intracavitae brachytherapy, surface applicator or mold brachytherapy, interstitial brachytherapy, and radioactive target intravenously brachytherapy. In the case of using each of these methods, the radiation source is placed on the skin or mucous membrane. It's injected directly into the tumor or into the exposed cavity. The shape of the radiation source can be linear, volume, suture material, and solutions. A brachytherapy patient is with typically localized cancer. The size of tumor is small. In patients with good performance status, must tolerate the operation. Sometimes pre-irradiated with external beam radiotherapy, such as combined or complex method of radiotherapy, and often treated with combination brachytherapy and external beam radiotherapy. In this picture, you can see interstitial brachytherapy. The source of radiation is placed into the tumor tissue. In this picture, you can see radiotherapy of breast cancer, and you can see that source of radiation is placed into the tumor tissue. In this picture, you can see applicators, radioactive sources inside with 2 ovoids, and intrauterine line, and an independent rectal marker, as you can see here. Okay. Vaginal applicators, you can see it's one type of intracavitae method of brachytherapy, using of them. One type of interstitial brachytherapy also for treatment of prostate cancer. Okay, Next type of brachytherapy is intracavitae method of them. Intracavitae method is used to supply the radiation source as close to the tumor as it possible, which is localized in the wall of an hollow organ. For this method is used as gamma and beta radiation source. Indications for the use: cancer of the vagina, cervix and body of the uterus, rectum, bladder, esophagus, and oral cavity. One type of brachytherapy is application method of them. Application method is a medical procedure in which radioactive drugs placed on the skin or mucous membranes using applicators. If thickness not exceed from 1 to 2 mm, use beta rays. It is used to treat tumors of the cornea, of eye and skin cancer. If the skin depth of the tumor up to 2 cm, use gamma therapy. Radiotherapy held in a special chamber equipped with protective screens because the patient is the source of radiation. Thus, in all types of brachytherapy, patient is source of radiation because patient has radioactive source into the tissue, into the body cavity, and it is so important. Okay, and the intertissue method of radiotherapy is a method of radiotherapy in which case the radioactive drug is injected directly into the tumor tissue. For gamma therapy, using closed radioactive preparations in the form of needles, granules, grains, suture material. For beta therapy, use colloidal solutions and suspensions of radionuclides such as aurum, iodine, and silicon. And the method of tropic accumulation of radionuclides therapy, incorporated elements. This method is based on the ability of certain tissues selectively accumulate radioactive substances. For example, selective accumulation of iodine in thyroid tissues served for use iodine radionuclide for therapeutic purpose. That's for treatment of thyroid cancer, we can use from radioactive iodine. Radioiodine therapy, treatment of hyperthyroidism that by result can be compared with the operation, but the advantage is that it's carried out without bloodshed, without the danger of operating death. Phosphorus selectively accumulates mainly in bone and acts on tumor cells with beta radiation. Because this method is used for the treatment of multiple bone metastases in the case of breast, prostate, and lung cancer. So we have been informed about applications, principles, and key points of radiotherapy. It's important to note that if the patient has any of malignant tumor, it doesn't mean that radiotherapy must be implemented. In all levels of radiotherapy, it is crucial to consider that we work with ionizing rays, and these rays can make biological changes in our body. Now, I would like to point out the main points of different periods of radiotherapy. First, about pre-radiation period. This period includes detailed examination of patient, general clinical, laboratory, and instrumental methods. You know that recently for diagnosis of malignant tumors, we can use from different types of diagnostic imaging, such as computer tomography, magnetic resonance tomography, different types of nuclear medicine imaging. Verification of diagnosis, cytological and histological examination of the tumor, needle biopsy. This procedure is so important in order to estimating of sensitivity of tumor cells. Determination of indications and contraindications to radiation treatment method. Assembly of individual patient treatment plan, and these plans are made by radiation team. Choosing method of radiation treatment, such as external beam radiotherapy or internal beam radiotherapy, type of treatment methods, X-ray therapy or gamma therapy and other, radiation fields and additional treatment measures, and finally pre-radiation preparation of the patient, such as making topographic anatomic CAT at the level of the tumor, depth of localization of tumor, and other. Okay, in radiation period, so important points are treatment, that in this period we provide treatment of a patient with certain plan. Duration of exposure ranged from 2 to 6-10 weeks. The combined methods of treatment, for example, radiotherapy and surgery, from 1 to 6 days. During radiation treatment is therapy support. It includes different treatment support drugs such as antioxidants, anti-inflammatory drugs and other. And post-radiation period, in this period is provide evaluating the effectiveness of treatment outcomes, degree of tumor regression, conducting of surveillance of the patient, prevention and treatment of radiation reactions. After radiation therapy, radiotherapy, clinical supervision of the patient is held 2 times per year. After 10 years of observation, if a person is healthy, it's removed from the cancer registry. Immobilization in radiotherapy. Rigid immobilization of patient and accurate positioning of their targets have long been recognized as critically important aspects of quality radiotherapy. Radiobiological studies have indicated that the slope of those dose response curve for many tumors is sufficiently large that a dose reduction of 3% to 5% to a portion of the tumor could significantly reduce the probability of local control. On the other hand, accurate positioning combined with rigid immobilization might permit reduced margins around the target, resulting in a decrease in dose to a normal tissue and potential increase in dose to the target. The increasing use of computer tomography-based three-dimensional treatment planning programs has made highly conformal dose distributions possible, thus further emphasizing the need for accurate positioning. The development of new immobilization materials and methods has made it possible to immobilize almost any area of the body of a cooperative patient to 3 mm, allowing the use of margins of no more than 5 mm, except when target motion within the immobilized patient and issue. Okay, role of immobilization in radiotherapy are
Patient positioning and immobilization are said to be the most crucial parts of radiotherapy treatment. For accurate delivery of a prescribed radiation dose to a target volume while sparing surrounding normal tissue. Without proper immobilization, the patient is at risk for improper treatment and unwanted side effects, and immobilization such as molds, casts, headrests, and other devices are contrasted to reduce setup error and patient movement during treatment. Although the primary goal of immobilization system is to limit patient motion and reduce the probability of major positioning errors, there are other benefits as well. A well-constructed immobilizing system can reduce the time for daily patient setup. It can reduce the reliance on patient cooperation and alertness, and it can help to stabilize the relationship between external skin marks and internal structures. Important devices for immobilization. They are easy for use, easy of making the device, comfort for the patient, minimal space requirement for storage, resistance to bending and stretching, and minimal perturbation of the beam so as not to produce artifacts in image acquisition. Okay. Now I would like to talk about head, neck, and brain immobilization during radiotherapy. Immobilization for head and neck cancer is one of the most important parts of ensuring proper treatment of the patient. In the past, patient forehead and neck cancer were taped to the table across their forehead. Bite block was occasionally. Current methods for head and neck and brain tumors include a variety of masks, molds, and frame systems. In some instances, shoulder straps are used to pull the shoulders out of the treatment field for the neck. In this picture, you can see immobilization device for head and neck cancer. The most common immobilization device used to treat head and neck cancer is an aquaplast, as you can see here. This device is made from a rigid plastic that becomes pliable when placed in warm water. When it is wet, it's placed over the patient's body and conforms to the contour of the treatment area. Advantages of aquaplast are: aquaplast provide great reproducibility in daily treatments, lightweight and easy to use. Additionally, modifications can be made to the mask if the patient experiences swelling or weight loss during the treatment. Disadvantages are: windows can't be used when oil becomes brittle and too soft when activated. Okay. Base plate, the plate onto which the head immobilization system is acquired is usually referred to as a base plate. Its material should be strong, yet it should minimally attenuate the radiation beam. Most base plates are acrylic, and recently carbon fiber base plates are highly developed. Indexing bar. The two-pin indexing bar is designed for reproducible positioning and stable fixation of base plates on the treatment couch, and the indexing bar can be placed as a desired indexing indents of the couch, and it can be locked down by rotating the layers. And the base plates, they can be positioned over the pins of the two-pin indexing bar. In patients with a short neck, or in patients where opposite lateral fields are used to treat the neck, the shoulders need to be retracted caudally to avoid entrance and exit doses. An elastic strap equipped with handles and attached to each side of the treatment couch can be used for the patient. Immobilization in brain tumors. Immobilization becomes more complex for radiosurgery or gamma knife procedures because the requirements for positional and numerical accuracy in dose delivery are approximately 1 millimeter and 5% respectively. Hence, highly precise and accurate reproducibility is needed. Two types of fixation systems are used in radiosurgery. First of them is GTS frame for fractionated therapy, and next the BRV system for single fraction radiosurgery. Okay. First, GTS relocatable head ring is non-invasive device that can be repeatedly fixed to the patient's head in precisely the same position. As you can see here, it has an impression taken of the patient's upper dentition, and the mold is then mounted to the head ring. An impression is also taken of the part to conform to the shape of the patient's head. A bracing strap holds these two components firmly in place so that precise repositioning can be achieved in each treatment session. The depth helmet provides quality assurance. It allows to confirm the positional accuracy. A depth probe with millimeter scale can be passed into the guide tubes on the helmet so that the distance from the hole to the patient's head can be measured to millimeter accuracy, as you can see here. In single fraction radiosurgery, invasive procedure is followed. The patient is fitted with a BRV system and then bolted to the treatment table. Bolts are fitted and screwed into the patient's skull to minimize any movement during treatment. Okay. For thorax and breast immobilization, there are two common immobilization systems used when treating tumors in chest cavity. First of them is VAC-LOCK. These are just back type pillows that are placed around the patient's upper body. The air is then vacuumed out of the bag for adjustment fit and sealed in order to retain its shape. VAC-LOCKs are radiotranslucent, almost air equivalent. They are washable and reusable. In this picture you can see it. You can see a VAC-LOCK device for immobilization of thorax and breast tumors. Second of them is breast board. Breast board is used specifically for the treatment of breast cancer. It has several adjustable features to allow for the manipulation of patients' arms, wrist, head and shoulders. Breast boards are generally constructed of carbon fiber, allowing the device to be lightweight and durable. In this picture you can see breast board for immobilization patient with breast cancer during radiotherapy. Carbon fiber boards have low attenuation levels which permit maximum beam penetration. The breast can also be immobilized using a thermoplastic breast support system. The aquaplast mold is taken of the breast to aid in placement when lying supine on a breast board. VAC-LOCKs can also be used to improve patient setups for the breast field. This type of treatment can involve the simultaneous use of the VAC-LOCK system with breast board. Okay. Pelvic immobilization. There are two different crucial aspects in the immobilization of pelvic region. First, to properly maintain patients' outer contour during treatment with respect to the center, and other is related to variation of internal structures during daily treatments. Immobilization systems such as back lock, belly boards, and the hip fix, such as Aquaplast system, are commonly used during treatments of pelvic region. Most of the pelvic malignancies are treated with partial body casts. A mask from the patient's mid-thorax to upper thorax is made by stretching warm, pliable thermoplast over the patient and then securing that mask to the pelvic board by a locking system. Windows on either sides can be cut on the mask so that skin tattoos are visible and can be used for alignment. A backlock can also be used for immobilization in pelvic treatment, so it should extend from the lower thoracic area to the mid-thigh. Backlock are popular choice for hip and pelvic positioning due to patient comfort and setup reproducibility. Advantage of them is easy to use, very little time to prepare, comfortable for the patient, and can be risked. Disadvantages are contour and shape may change with handling and use and expensive. Okay, belly boards are used when the patient is treated prone, and belly boards allow the small bowel to drop below the lateral field to avoid severe side effects of irradiation. In this picture you can see belly boards. Use of the belly board significantly decreases the average volume of small bowel that would otherwise be within the lateral field during standard box technique treatment. Accurate delivery of the prescribed treatment is critical to achieve a successful outcome in radiotherapy. There are many sources of uncertainty in the radiation therapy delivery processes that can result in a geometric miss of the intended target value. The goal of immobilization and stabilization techniques is to reduce positional uncertainties from patient motion during each fraction and to also increase the reproducibility of the patient setup for each fraction. Immobilization devices can decrease the time needed for daily setup and target localization, thus increasing a clinician's through path. Certain immobilization devices may also allow setup marks to be made directly on the device instead of the patient's skin, which can improve the patient's physiological well-being while under treatment. The immobilization system should be lightweight for ease of setup and transport, yet strong and durable so that the device does not break during the patient's course of treatment. Furthermore, the device should be made of materials that minimally affect the megavoltage treatment beam and don't cause computer tomography imaging artifacts that could impact three-dimensional visualization of the patient anatomy. Today, I have explained about the methods of radiotherapy, and radiotherapy can be used alone or as an effective neoadjuvant and adjuvant treatment in combination with other treatment modalities such as surgery, chemotherapy, and hormonal therapy. And you already know that the aim of radiotherapy may be cure, control, and palliation, and offering benefits in terms of organ preservation, quality of life, effective palliation or science. The treating team
considers a range of factors when deciding on a course of radiotherapy. Tumor-related factors include the site of the cancer, an histology proven cell type, the grade and stage of the tumor, and the radiosensitivity of the tumor. That is all. If you have any questions, please don't hesitate. Send me. Thank you for your attention.